Welcome to Cleveland Clinic, Florida. My name is June and I'm the Chief Resident for the Internal Medicine Department. I am so glad you have joined us today and I'm excited to introduce you our program. We are located in sunny South Florida in Weston, near Fort Lauderdale. We are one of the top healthcare systems in Florida with all internal medicine resident rotation in one campus. Let's take a look at the schedule. Our blocks are organized into 2-week blocks and we use the X plus Y system, in our case 6 plus 2. You will have 6 weeks of floor, ICU, nights, or electives, then 2 weeks of ambulatory block. During the PGY 1 year, you spend most of your time on the general medicine floor to build a basic foundation for the rest of your internal medicine career. As you progress toward the third year, you'll have more electives, up to 8 blocks in a given year. In our program, we do not have a 24-hour pause. Instead, we have a night flow system. Another interesting aspect of our program is the vacation and holiday time. Aside from 15 vacation days and 5 sick personal days, we have a winter holiday schedule where we added 5 to 7 extra days for holidays. Let me introduce you to our hospital. We currently have 212 general floor beds, including the observation unit, plus 48 beds in the intensive care unit and 40 emergency room beds. As a tertiary care center, we see a variety of pathologies and at times manage incredibly sick patients. We have 3 floor teams, each team with 1 attending, 1 senior, 2 junior residents, along with medical students, observers, and pharmacy residents who are always welcome to join our rounds. Our faculties use combination of bedside and table rounds for teaching. We use Epic as our EMR for both inpatient and outpatient. We increase our patient cap slowly to make sure you have gradually increased responsibilities as you start your training. For a typical day on the floor, you will see your patients pre-round with the senior, formally round with the team, have a protected conference time from noon to 2, and finish your work with signing out to the night resident. We are on call every 3 days. On a typical call day, which is from 7 a.m. to 7 p.m., the admission can start from 10 a.m. and last until 7 p.m. Once you are done with your work, you will sign out to the night resident and leave for the day. On a weekend for a non-call team, once you are done with the round and finished with your work, you can sign out to the call team and leave. The call team schedule will be same as mentioned previously, 7 a.m. to 7 p.m. Only 1 junior resident per team per day will work during the weekend, and the other resident will be off. The schedule is made to ensure you have a minimum of 4 days off during a 4-week block. This is one of our intensive care unit beds. The ICU rotation is our most intense rotation, yet it is also one of the most favored rotation of many of our residents, to a point that many residents decide to become critical care physicians. The ICU has 2 teams, each team with 1 attending, 1 fellow, 1 senior, and 1 junior resident. The ICU rotation starts with the sign out at 6 a.m. You pre-round with your senior and have a multidisciplinary round. The admissions come throughout the day, alternating between the teams. The team also alternate calls every other day with 1 junior and 1 senior resident leaving at 4 p.m. and the other leaving at 6 p.m. You will work 1 full weekend and be off the other full weekend during the 2-week block. You'll be doing most of your procedures while you are in the ICU block. You are only required to get certified on central venous catheter placement, but you will have plenty of opportunities to do other procedures such as thoracentesis, paracentesis, and intubation, even on the floor. Let's move on to our night schedule. We cover 1 week of ICU and another week of floors during the night block. The ICU is from 6 p.m. to 6 a.m. and the floor is from 6 p.m. to 2 a.m. The floor pages from 2 a.m. to 6 a.m. are addressed by the junior resident in the night ICU. You will have Fridays off during the night block. You will have some required electives called selectives and other electives of your choice throughout your training. While you are on electives, you will work Monday through Friday, starting with morning reading. You'll work with attendings and fellows and have protective conference from noon to 2 p.m. It will be the perfect time to catch up on your rest and enjoy your weekends. Residents also have opportunities in their second and third year to rotate at Cleveland Clinic, Ohio, or another hospital of their choice. Like the elective block, in the ambulatory block, you will start the day with morning reading, followed by either continuity or subspecialty clinic. Then we'll have protected conference from noon to 2, followed by afternoon continuity or subspecialty clinic. On Wednesday afternoons, we alternate between focused curriculum and simulation plus academic half day. Just as the elective block, you work Monday through Friday, and you are off during the weekend. During the clinic block, you also get half day of admin time. You will have time to enjoy the beautiful Florida weather and soak up the sunshine. During our protected conference time from noon to 2, we cover a variety of topics. Our lectures are from our Emeritus Program Director, Dr. Muniz, other subspecialty faculties and fellows, multidisciplinary team members, and guest speakers. On Fridays, we have Journal Club, Internal Medicine Morbidity and Mortality Conference, Intern Talk, Population Health Lectures, as well as wellness activities and house staff meeting. During our conference time, we also have teaching rounds similar to other programs' morning report. We discuss differentials, workups, and treatment plans, and build critical thinking in a safe learning environment. On Fridays, we focus on topics that are important in managing patients in outpatient setting. The residents participate by presenting patients and having a formal presentation on topics that are discussed. As mentioned previously, on clinic and elective blocks, we have morning reading club. It is with Dr. Muniz Monday through Thursday and with Dr. Sider on Fridays. Reading club is where we review mix-up in small groups. The wealth of knowledge Dr. Muniz shares with us every morning never ceases to amaze me. We have 100% board pass rate in the last 12 years, and I truly believe our strong didactic plays a huge role. No wonder our graduates went on to fulfill their career choice, from being a cardiologist to a hospitalist. I look forward to our match result this year as we have a wonderful group of PGY3s. Many graduates choose to stay at Cleveland Clinic as they enjoyed their training and the people they work with. In addition to healthcare benefits, residents also receive book reimbursement and food stipends. There is conference reimbursement for second and third year residents. All these benefits are in the process of getting a good raise this January. You will get an iPhone that also works as your pager. Another noticeable benefit is, aside from maternity or paternity leave, we have at-home electives for new parents so they can continue their training while spending quality time with the new family member. The call rooms in the hospital have plenty of workstations, sleep rooms, shower area, fridges, and many types of coffee makers, including drip, capsule, and espresso. This is where our residents spend most of their time in the hospital. It is where they work, but also where they enjoy each other's company. We pride ourselves on being close-knit and family-like program. We celebrate with each other for the birthdays of many years and in welcoming of the newest member of the family. Small or big, same or different, we learn to accept each other as who we are and appreciate what everyone can bring to our program. We start the junior residents with the team building activities during the orientation week. From the first day of the orientation to the graduation celebration, we build lasting professional and personal relationships with faculties and core residents. Hope you look forward to joining us to become a part of this large family. If you have any questions about our program or the interview day or South Florida in general, please feel free to reach out. We look forward to meeting each of you and hope that you found this presentation helpful.